Welcome to your Barbados Today Evening News Update for Friday, October 30. So glad you could join us. Barbados again gets a thumbs up from the International Monetary Fund for making good progress in implementing the Barbados Economic Recovery and Transformation Program, BERT. And the fund has agreed to a further ease in the primary balance target under the 4-year program that began in October 2018. On Friday, the Washington-based institution announced that it had reached another staff-level agreement with authorities in Bridgetown following its 4th review of the BERT plan. This means that under the extended fund facility, Barbados will be able to draw down about US $90 million upon approval, which is expected by December. At the same time, the IMF has agreed to review a proposal for an augmentation of the EFF in the amount of $66 million to help finance the emerging fiscal deficit and balance of payments needs. The IMF team, led by Bert van Salm, conducted a virtual mission between October 26 to 30 to assess implementation of the BERT plan. In other news this Friday, government will have to fast-track the development of an action plan to address the needs of the elderly in this new COVID-19 environment. That's the view of Elder Affairs and People Empowerment Minister Cynthia Ford, who says the viral illness has compounded the challenges facing the elderly. She was addressing a national conversation on aging and elder affairs today.
For many, aging is a time of poor health, loneliness, and anxiety. This was significantly compounded by the COVID-19 pandemic that introduced protocols of social distancing, restricted social activities, including church-going, usually an important part of Caribbean older persons' lives, overall minimal human contact, and increasing use of technology. And while, as you previously heard, we had always intended to rethink the delivery of social services to the elderly in Barbados, the numerous gaps uncovered by the experiences of COVID have forced us to fast-track our review to find the best strategic decision to support and protect our elderly population.
Minister Ford stressed the country must identify and tackle head-on the challenges the elderly will face.
These include being unprepared for retirement, grief from losing a spouse or partner or child, or relative that is close to them, feeling of social exclusion when everyone else seems to be so busy with their own lives, a decline in living accommodation due to lack of income, difficulty in accepting physical changes that are simply a result of getting older, and malnutrition due to loss of appetite, especially when living alone. In addition, some older persons may find themselves being caregivers for spouses and other relatives, and that too impacts on their health and their performance.
Sandals Resorts International is hoping to boost visitor numbers from the German and the wider European market through a partnership with local tourism officials. Dominic Reber, managing director of Sandals Europe, told members of the media today that the popular hotel chain initiated a fam trip to bring some of Germany's best-selling agents, tour operators and partners over to Barbados. He says initiatives like these are critical for the revival of tourism.
The message to the industry is we need these sort of initiatives. The people out there, our customers, our mutual guests, don't know what to do anymore. They're confused. There's so many changing messages, not even on a daily, but on an hourly level. So sensibilizing for the new ways of travel, for all the hygiene requirements, the concepts, the protocols, is absolutely essential to create transparency. In the end, we're only going to do this together, as the various stakeholders along the chain of production in the tourism industry. No one will make this on their own. And this is the very important message that we're trying to give with this, is let's work together as an industry. Let's ensure we put everything in place that the guests, our mutual visitors, can be as safe as possible in this unfortunate time that we're in.
Reber lauded Barbados for its protocols, saying officials are doing a fantastic job.
Even though the protocols are strict, the island is safe, and this means a lot today. I think it's sort of seen as a safe haven in the world. You guys are obviously aware that we have heavily increasing numbers in Europe again. So obviously a lot of the countries unfortunately went into high risk again. But the island has done fantastic, and I can only encourage you, keep the protocols up, keep to the concepts, everything that you're doing, because you're doing something right.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news now. In Jamaica, health authorities warn the country is facing a triple threat of dengue, COVID-19 and the flu. And according to Health Minister Dr. Christopher Tufton, Jamaicans will have to take greater responsibility for their health during this challenging time. Ocean Masters of Television Jamaica tells us more.
With the recent heavy rains island-wide and more expected this weekend, concern is being raised about the increase in the population of the Aedes aegypti mosquito. Speaking at Thursday's COVID Conversations, Health Minister Dr. Christopher Tufton says based on a recent model done by his ministry, trouble is on the horizon if personal measures are not taken. He says it could also hamper the fight against COVID-19 if it is compounded with a flu and dengue outbreak as well.
If we are complacent, in addition to our COVID-19 cases, we could have, I am told by the experts, more than 300 dengue cases and 3 to 5 dengue deaths each week.
Last year, the island recorded 88 dengue-related deaths. That is almost double the confirmed deaths for the disease in 2018. According to Acting Chief Medical Officer Dr. Karen Webster-Carr, the health sector could be in trouble if there's a similar dengue outbreak this year.
If we should, say, take out the number, look at the number of cases that we had for dengue last year and influenza-like illness and transpose it and put it on to the rest of the year, then the lighter shade is what we would have. And this would be significant challenges on the health system with more admissions and more deaths.
On the international scene, a massive earthquake struck in Turkey and Greece today, claiming 19 lives. We get the details from Reuters Television.
A strong earthquake hit the Aegean Sea on Friday, bringing buildings crashing down in Turkey and setting off tidal waves which slammed into coastal areas and nearby Greek islands. A magnitude of up to 7 was recorded for the quake when it struck in the afternoon. Early reports from the Disaster Emergency Management Presidency say that there have been several fatalities, with hundreds more injured. In the Turkish tourist destination of Izmir, there were reports of people stuck in the rubble of collapsed buildings. Some neighbourhoods were deluged with surging seawater, sweeping a flood of debris inland and leaving fish stranded as it receded. Residents of the Greek island of Samos, which has a population of about 45,000, were urged to stay away from coastal areas. High tidal wave warnings were in place across the area, with the Vice Mayor saying they'd never experienced anything like it.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.